We recognise the strength and resilience of all Aboriginal Torres Strait Islander peoples and are dedicated to a future in which they feel connected, empowered and safe within the communities of the Loddon Mallee region. Always was, always will be.
Thanks, Trisha. We'd also like to acknowledge the people who made this event possible today. Welcome and thank you goes to our Auslan interpreters this morning, Esther Campbell and Rebecca Cramp. And we also have a few Women's Health Loddon Mallee staff who will be ensuring that things run smoothly as possible today. So thanks to Kat and Sarah. Kat and Sarah will be keeping an eye on the chat and making sure that we're seeing the people we need to see as we go along. And it's been an absolute pleasure to co-create this event with Helen Ferris and Lena Molnar from Women with Disabilities Victoria. So Helen Ferris has a professional background in community services with qualifications in social work, community sector management and family dispute resolution. As Health Services Promotion Program Manager with Women with Disabilities Victoria, Helen oversees projects to support disability inclusive PVOR, so that's prevention of violence against women, within the women's health service sector and build greater inclusion in health practice. Helen also currently serves as a director of Blind Citizens Australia. Welcome, Helen. And also to introduce Lena. Lena Molnar has a background working in universities, community education, childcare and conducting people research. And at Women with Disabilities Victoria, Lena is the Workforce Capacity Building Officer for Gender and Disability Equity. Lena supports women's health services organisations to incorporate disability inclusion into people practice. So I will be handing over to Helen and Lena shortly, but I just wanted to let you know that we will be covering the topic of violence against women with disabilities through this morning's session. And please look after yourself in any way that you need to. Feel free to step away and take a little break. If you find yourself in need of a debrief about some of the information or something's come up for you during the session that you want to unpack further, we're just sharing some support services now in the chat. And please do reach out to someone if you or someone you know needs support. Thanks, Sarah. Just briefly running through the structure for the next couple of hours together. We're here to have a look at the new national resource to prevent violence against women and girls with disabilities, Changing the Landscape, which has been produced by Our Watch and Women with Disabilities Victoria. And Helen and Lena will guide us through this process during the first half of the session today. And then we'll have a 10-minute break as close to 10:25 as possible and spend the second half of the session in the company of Nicole Lee, our guest speaker today. So Nicole's also spent some time co-creating the second half of this session with us, and she welcomes questions from you via the chat function during the latter half, and Sarah will be helping us to address as many of those questions as possible, but we may run out of time to address all of them. And to get us started, Sarah's just going to activate a little poll to start us off. And I just lost what I'm looking at, so just excuse me. So the poll, I've lost my whole page. Sorry, excuse me. Great, some of you are off and running. So since registering for this event, have you read Changing the Landscape, a national resource for the prevention of violence against women and girls with disabilities? You'll probably notice you were asked this on registration, and we're just sort of seeing since registration whether people have had a look or whether we've got, we've got a real mix of knowledge in the room here, Helen and Lena. So I think it will be a very useful session. Thank you, everyone. We've got everybody answered. So the results are, we have 4 people said yes, 9 people have said no, they haven't, and 10 of you have had a quick glance. So that's fantastic. And Lena and Helen, I will now hand over to you to share the resource with us.
Thank you, Hayley. It's really, really nice to be part of this forum today. I'm Helen Freris, as Hayley said, and my colleague Lena Mulder and I are really happy to be working with Women's Health Loddon Mallee. We've enjoyed a very long and successful partnership and series of activities. So this is another thing that we can share together. And thank you to everyone who is here. I'd like to acknowledge that I am today on Bunurong and Wurundjeri land, and I'd like to acknowledge the traditional owners of that land, past, present and emerging, and also recognising that this land has never been ceded. We're going to take you through this morning the resource Changing the Landscape, and it was really interesting to have the results of the poll. Some people have read it, some people haven't. We'll go through a little bit of it together, and hopefully you'll be encouraged to read it through. So, excuse me, my screen reader tells me every time someone enters the waiting room. All right, so let's talk about changing the landscape. This is a national resource to prevent violence against women and girls with disabilities. It complements existing resources, but expands and extends them. So there's the evidence and guidance in Change the Story is there, but it also builds, deepens the understanding of violence against women and girls with disabilities and its dynamics and impacts, offering a conceptual model that practitioners can use to explain the underlying and intersecting drivers of this violence. It provides a set of essential actions that practitioners and others can use to prevent violence, to address the drivers, the underlying drivers, at all levels of society, provides supporting actions to address the reinforcing factors that reinforce violence against women with disabilities, and it offers principles for prevention that guide the way in which the essential and supporting actions should be implemented. So the guidance and discussions we'll speak about today is practice-based knowledge that can be implemented across different fields to prevent violence against women with disabilities before it begins. And so this resource is useful, particularly for those working in roles where they can engage with policy and organisational strategies, other ways of challenging violence supportive structures, as well as with people working in disabilities sector organisations more broadly. So I'm going to hand over now to Lena to talk a bit more about primary prevention, because this is quite an important concept in changing the landscape. Thanks, Lena.
Thank you, Helen. So primary prevention is discussed quite a lot in this resource, and we explain it as an upstream approach. So you can see on this slide a river where primary prevention, it happens upstream, where we are trying to prevent violence from happening in the first place. The second stage of this approach is called early intervention, and this is work that tries to help people at the early signs or indicators that violence could be happening. The third stage of prevention is crisis response. So this is further down the river, where the problem has already advanced and someone has been hurt. So rather than waiting to treat the problem of violence against women and girls with disabilities downstream, where it has already become a very damaging and costly crisis requiring early intervention or crisis response efforts, primary prevention means identifying and changing what is happening upstream in order to prevent the problem from occurring in the first place. So examples of primary prevention approaches can include school-based approaches to promote respectful relationships and gender and disability equality, as well as initiatives to reduce the disrespectful portrayal of women and girls with disabilities in the media. Some people may be doing primary prevention work without thinking of it as such. For example, by addressing unequal policies and practices in the workplace, such as inaccessible hiring practices, addressing pay gaps, or the lack of women with disabilities in leadership roles. So if we want to change the landscape, we have to think about how to engage in actions that prevent violence against women and girls with disabilities from occurring to begin with, as something that we can all do, and how the resources and what the resources are to intervene and respond to harm if it does occur, and how these actions can support one another. So the next concept that the resource discusses is the Socioecological Model for preventing violence against women with disabilities, and Helen will help us talk about that.
Thank you, Lena. So there is a figure, a visual image on the slide, and it illustrates the socio-ecological model, and it's broadly used in work for the primary prevention of violence against women. It's probably quite familiar to anyone involved in prevention of violence. It's implemented throughout Changing the Landscape, so it's quite important, I think, that we cover it here briefly today. So it shows examples of structures and norms, practices found that increase the probability of violence against women and girls with disabilities at different levels of the social ecology. So starting, it helps us to think about the model, the things that we personally and as groups or businesses, institutions across society can do to change so that violence against women with disabilities can end. So we see the highest level, the social level, dominant social norms that support rigid gender roles, stereotypes about not only gender but disability. So ableist beliefs, stereotypes about people, women with girls with disabilities, or the condoning, excusing, downplaying of violence against women and girls with disabilities. So that's the social level. As we go further inwards into the diagram, the second level is the system and institutional level. So this talks about systems, failure of systems, institutions and policies to promote economic, legal and societal autonomy for women and girls with disabilities, or to protect their human rights or address violence against them. The third level, if we move even further in, is the organisational and community level, and that's the level that's influenced by the systems and institutions that we spoke of just before in the previous level. This is where it starts to really happen. So organisational and community norms, the way that organisations are run, governed, the way that community operates. Again, norms, structures and practices. You'd be familiar with this from Changing the Story. And these norms, practices, structures support or fail to address gender inequality, ableism, stereotypes, discrimination and violence. So moving further to the final level, the individual and relationship level. So as individuals and as people, groups in relationships, we adhere to these norms, practices and structures as well. So rigid gender roles and identities that individuals promote and enforce. Individual attachment to ableist beliefs. We'll talk a bit more about ableism later on. Weak support for gender or disability equality, and the social learning of violence against women and violence against people with disabilities, and the social acceptance of that violence, male dominance and controlling behaviours in relationships. So this model reminds us no matter where we are in the model, we can always challenge the drivers of violence against women and girls with disabilities. And that's it can be confronting to recognise that, but also reassuring, because it means that as individuals, wherever we are in the settings that where we are found, we can make a difference to some of those drivers. All right, so I'm going to ask Lena to come back and tell us a bit more about violence against women with disabilities. Thanks, Lena.
Thank you, Helen. So women with disabilities are more likely to experience a broader range of violence than men with disabilities throughout their lifetime. 65% of women with disabilities experience violence during their lifetime. They're twice as likely than women without disabilities to experience sexual violence and intimate partner violence. And the rates of violence that women with disabilities experience can be even higher for women with specific types of disabilities. They experience sexual violence between 25 and 33% of women with disabilities experience sexual violence in comparison to 15 to 16% of women without disabilities. And rates of intimate partner violence are 30 to 36% of women with disabilities. 21% of women with disabilities and there are specific type of disabilities that, such as psychosocial disabilities, intellectual disabilities, and complex communication needs that can compound the experience of violence for women with disabilities. Changing the Landscape also outlines the multiple forms of violence that women with disabilities can experience. They experience violence over longer periods of time, in more settings, and by more perpetrators. They are also less likely to report and seek support than women with disabilities due to fear of not being believed. So there's a quote on this slide that from a woman with disabilities saying, "If I'm not in my wheelchair when a fight erupts, my partner will push my wheelchair out of my reach. This prevents me from being able to leave. I'm forced to listen to him berate me until he's tired and feels like I deserve my chair back." Changing the Landscape defines other types of violence that women with disabilities experience, such as disability hate crimes, which are crimes involving violence that are motivated by extreme ableism, as well as domestic, family, and intimate partner violence, financial abuse, medical exploitation or abuse, neglect, depriving a woman of the necessities of life, physical violence, psychological or emotional abuse, restrictive practices, such as practices or interventions that restrict the rights or freedom of movement for a person with disabilities, sexual and reproductive coercion or violence, sexual harassment, sexual violence or assault, spiritual and cultural abuse, and technology facilitated abuse. So I'll refer back to Helen again to explain this term ableism, which we have already used quite a bit now, as it's an important concept that we use in Changing the Landscape and in our work.
Thank you, Lena. We have referred to ableism a number of times, as does Changing the Landscape. If you read it, it often uses that term. So let's go back and define what that means. So ableism is a system of beliefs, processes, and practices that privilege people without disabilities and disadvantage and exclude people with disabilities. And privileging people without disabilities normalises the way people without disabilities do things, as opposed to the way that people with disabilities do things, which are seen as inferior or faulty in some way. So there have been a few different models over the generations, really, that have conceptualised disability. So we talk often in the sector about the medical charity models, and neither of these have empowered women with disabilities particularly well. The medical model sees very broadly, sees disability as something to be fixed. Problem, as an intervention, it will fix it. And people are, really encouraged to fix themselves or get fixed. The charity model treats the symptoms of the disability, but not the issue itself. And there's an illustration there that goes through what those models are. So just thinking again about ableism, the beliefs include dominant ideas and expectations about typical abilities of people, people's bodies and minds and how they work or should work. Society applies these standards to determine who is worthy, able or normal, in quotes, and discriminates against and disadvantages people who fail to meet this imaginary standard. And it does change over time and across cultures. There's no set standard of normal, but it's always there. So these beliefs, process and practices lead to people with disabilities being denied fundamental human rights and being devalued generally in society. And they create the kind of social context which gives rise to and supports violence against people with disabilities. So if we think about the Australian context, which we're most familiar with, ableism is found across our legal frameworks, policy, and planning about the lives of people with disabilities, including where we live, how decisions about our lives are made, who we live with, how we can access public spaces if we can at all. These are largely influenced by the medical model or the charity model sometimes, and this model promotes special laws, policies and practices, segregation, paternalistic processes such as substituted decision making in a lot of cases. So I'm going to ask Lena to substantiate further on the social model of disability, if we can.
So in changing the landscape and in a lot of our work, we are informed by a different meaning of disability, which has evolved and developed over time, as Helen said. Understanding that not all people experience or understand disability in the same way. So the social model of disability understands that disability exists as a result of the interaction between a person's impairment and barriers related to the attitudes, environments, and communications and institutions that they're around. This is society's responsibility to recognise and remove those barriers. We also use the human rights model to take the social model further. So people with disabilities have the same rights and fundamental freedoms as everyone else, all people. And governments are responsible to ensure that everyone enjoys the same human rights. So some people do not have an official diagnosis. They may not want a diagnosis or identify with their diagnosis or disability, and others are misdiagnosed for other various reasons, such as the use of culturally inappropriate, gender biased, or otherwise discriminatory assessment tools. So the concept of disability is also culturally specific. For example, some Aboriginal and Torres Strait Islander people may have traditional understandings of disability that differ from Western concepts, and they may be less likely to self-identify or to identify another person as having a disability. So there's generally a high level of stigma associated with disability across most communities. So utilising the social model of disability, which is embedded within the United Nations Conventions on the Rights of Persons with Disabilities, we can refer to impairment as a person's actual functional limitation, whereas disability exists as a result of interaction between these barriers and impairments relating to the environments, institutions, and communications and attitudes. So here we have a case study to think about how we might apply the social model of disability. Think about any time you might set up an activity and you might want as many people as possible to come. This might happen at home or in your workplace. And we have a group of women here who want to attend. So the image to the right of the text illustrates 6 culturally diverse women, and some are using mobility aids. One has a hearing device, another has a prosthetic limb and is holding a baby. They all look very happy. How do you know that they will be included? Questions that we suggest you think about is, does the information online adhere to web content accessibility guidelines? When is it that you budget to accommodate for access requirements or assistance from the venue's door to the event room? How is this planned for online events? How are women's experiences included? So applying the social model of disability lets us reflect on the assumptions that we make when we organise our activities and where those ideas come from. Who's missing out and what are the risks of having those people miss out? How is the experience of people with disability incorporated and included into your program? And has the event been timed with sufficient breaks, mindful of parenting responsibilities or the impact of online engagement? If the social model of disability is not applied to work with the aims to prevent violence against women and girls with disability, there are risks that prevention initiatives will not represent women and girls with disabilities. Community events will be held without thought to disability access. Training will be delivered that does not reach women and girls with disabilities, and service systems will run services without flexibility to make reasonable adjustments. So I'm going to refer back to Helen now to talk about why we use a gender equality approach to disability.
Thanks, Lena. So hopefully just thinking through that case study helps us to think about the impacts, the combined impacts of gender and disability. And we've chosen the example of events because a lot of people work in communities happens in the context of events. And it's often the first encounter that a woman with disabilities might have of your organisation. So it's a good practical exercise to do, to start thinking about how accessible events really are. So coming back to the concept of gender equality involves providing equal opportunities and outcomes for people with all genders. And it requires shifting resources and structures that create gender inequality. So it actually means that things have to be challenged a bit so they can be different. Gender equality approaches recognise diversity and they address the disadvantages created in a society that treats women, gender diverse people, as having less value. When we change the landscape with a gender equality approach, we challenge the existing inequalities between men, women, gender or sexually diverse people. And there's another image, a group of people, disabilities, genders, ages, and scales, showing where they are. So really what we're doing is thinking about how gender impacts how we think about disability equity. And according to Changing the Landscape, a gender equality approach means understanding how people are treated differently based on both their gender and their disability. So a man with a disability will have different experiences to women and non-binary people with disabilities. And a trans person with a disability will have different experiences to cisgender people. We live in an unequal society, and women and gender diverse people are treated as having less value and being less worthy of opportunities, as are people with disabilities, as we've said before. So I'm going to just share a little bit about the ableist drivers of violence against women and girls with disability. Coming back to the term ableism that we spoke about earlier, there's an infographic of the drivers, which I'll read. So we think about negative stereotypes about people with disabilities, accepting or normalising violence against people with disabilities, controlling people with disabilities, decision-making and limiting independence, social segregation, exclusion of people with disabilities. And so ableism, as we can see, manifests in many ways. And research and consultation undertaken for changing the landscape suggests that there are expressions of ableism that play a role in driving violence against women and girls with disabilities. And these drivers occur at multiple levels of society and interact and reinforce each other. And these are described in Changing the Landscape, and they're the items that I read before. So the first driver, again, people with disabilities are perceived as being childlike, burdensome, or incapable, and it contributes to people with disabilities being perceived as less worthy of respect, more legitimate targets of violence that we can see. And we see that a lot in our media discourse about people with disabilities, for example, how expensive the NDIS is and how much it costs to support people. The second driver, when society accepts or normalises violence against people with disabilities, the rates of violence are higher and perpetrators of violence are less likely to be held accountable. Violence against people with disabilities is normalised and accepted across society in many ways. So excusing the behaviour that happens by attributing to other factors, for example, carer stress or burnout, as a justification or a downplaying of the violence and its impacts. The third driver, ableism, as we've said today, occurs across society. Laws that limit people's decision-making and independence of people with disabilities, so substitute decision-making policies, and in public and private settings. So women with girls and with disabilities, for example, are more likely than men and boys with disabilities to be ignored, disregarded regarding issues that impact their lives, such as healthcare, living arrangements, sexual and reproductive autonomy, parenting, employment, and the list can go on for a long time. But we'll move on to the next driver. Ableism happens, as we've said, through formal policies of segregation, such as education, segregated employment, where people are paid less, and somehow that seems acceptable to us, segregated living arrangements, disability enterprises, group homes, and in practices such as indefinite and arbitrary detention. Women with psychosocial disabilities are among the fastest growing groups of people in incarcerated people. And there are attitudes that exclude people from disabilities from participating in society. So buildings not being physically accessible means that people can't use those buildings. I'm going to ask Lena to continue on with this discussion by talking about the intersecting drivers of violence against women and girls with disabilities.
Thanks, Helen. Okay, so this figure from Changing the Landscape shows in a simple way how gender inequality and ableism overlap for women and girls with disability purposes. For explanatory purposes, it is useful to think about what we know as the gender drivers on the left, condoning violence against women, men's control of decision-making and limits to women's independence in public and private life, rigid gender stereotyping and dominant forms of masculinity, male peer relations and cultures of masculinity that emphasize aggression, dominance and control, and how these ableist drivers of violence that Helen described before. So significantly, rates of violence are likely to be higher for women and girls with disabilities who also experience other forms of oppression based on factors such as race or sexuality, age, class, and gender diversity. So many people with disabilities also experience ageism, classism, heteronormativity, homophobia, biphobia, transphobia, cisnormativity, racism, and colonialism. We all have multiple identities, and intersectionality is when two or more of our identities come together within systems and structures that harm and discriminate against people based on these identities. Different forms of inequality, discrimination, and oppression are not separate or additive, but rather are intersecting, mutually reinforcing and compounding processes. So for example, evidence suggests that the prevalence of violence experienced by Aboriginal and Torres Strait Islander women with disabilities is significantly higher than violence against non-Aboriginal or Torres Strait Islander women with disabilities. We also know from emerging data that ableist drivers affect women with disabilities from migrant and refugee backgrounds in distinct ways to those born in Australia. When women with disabilities in Australia also already experience barriers to reach out or to be heard when they've experienced violence, the other drivers of violence can impact and exacerbate their experiences. There are significant barriers to reporting, that is just reporting data or being researched, that also impact how much we know about the nature and experience of violence against women with disabilities. So as a result, the rates of violence are also likely to be higher than the data may suggest. So to put prevention of violence against women and girls with disabilities into action, I'm going to lead back to Helen, as there are some essential actions in changing the landscape that I'm sure you're very interested in.
Thanks, Lena. So we've talked about what the problem is and how it impacts on the lives of women and girls with disabilities. So the question that you're probably asking is, what can we do about this? How can we bring about change to prevent this violence? So, you know, how can we actually put these, there's a list of actions on the slide, and it's important as practitioners to think about how can we put these actions into place, what changes need to happen so that the drivers that we've spoken of can be addressed, and how can people in our organisations build capacity to include women with disabilities. And we'll talk a bit about that one later on when we hear from Women's Health Loddon Mallee. So the essential actions are described in changing the landscape, and they're helpful for all of us to think about different ways that we're placed to address the drivers of ableism and gender inequality together. So if we think about the first one, build nationwide support for investment in gender and disability equality. So thinking about how can people be equal to each other, developing appropriate structures to implement, monitor prevention efforts to see how we're travelling with that, ensure all gender equality and violence prevention work considers women and girls with disabilities as valuable for the efforts that are being made, ensure that all work that addresses ableism specifically considers women and girls, and ensure all work to prevent violence against women takes an intersectional approach. So we're really thinking about the impacts, the combined impacts of gender and disability. The second action is improving the understanding of violence experienced by women and girls with disabilities to inform the actions that we take. To ensure legal protection from all forms of violence for women and girls with disabilities. Challenging workplace practices that normalise violence against women and girls with disabilities or that discriminate. Challenge social support for attitudes that excuse and normalise violence against women and girls with disabilities. So focusing on perpetrator accountability, including challenging what we call the halo effect, rather than attempts to shift blame from the perpetrator to the victim survivor. And challenging the suggestion that disability is an excuse, for violence. So we come to the next action, which is challenging ableist and sexist stereotypes within the community. So women's girls with disabilities, we know, So things like there's an assumption that women and girls with disabilities don't want sexual or intimate relationships. And so they often are denied access to respectful relationships education. And for most women and girls with disabilities, that's not true. So women and girls with disabilities can make their own decisions in that aspect of life and need to have the knowledge to be able to do so. So improving representation of women and girls with disabilities in the media and popular culture in a way that's positive, supportive and equal. So promoting positive representations of women and girls with disabilities by workplaces. So the next action, using legal and policy measures to promote the social inclusion of women with girls with disabilities. And this is an important one because a lot of the discrimination and ableism of which we've spoken stems from policies and practices. So amending laws, policies and practices that enable segregation or arbitrary detention of women and girls with disabilities, promoting inclusion of women and girls with disabilities in political, public and community life as equals and as valued contributors to that life. Ensuring equitable access to all forms of education for women and girls with disabilities, facilitating equal employment and economic participation of women with disabilities, because as we know, economic participation, access to economy brings power with it. Facilitate access to safe, non-segregated living arrangements of people's choosing, of course, and an adequate standard of living. So ensuring that group homes aren't substandard where people are just warehoused. So the next action, action 5, ensuring laws, policies and practices promote decision-making for women and girls with disabilities. So previously we talked about, laws and policies promoting equality. We also need to think about women and girls with disabilities as being able to make decisions and have agency themselves. So challenging norms that limit women's independence or autonomy, agency, participation in leadership and decision-making. So that might be implementing specific initiatives that enable women and girls with disabilities to exercise their right to decision-making, providing support for that to happen, promoting the rights of women and girls with disabilities to participate equally in positions of power regarding issues that impact their lives, such as healthcare, living arrangements, right to have children, and other aspects of life just generally. And then the next action, challenging rigid attachments to harmful ideas of masculinity. So challenging male peer group cultures that emphasise dominance, challenge rigid ideas of gender stereotyping, promote positive alternatives to those. So I'm going to now hand over to Lena to talk about the prevention principles that can be used to prevent violence against women with disabilities. Thanks, Lena.
Thank you, Helen. So the prevention principles to prevent violence against women and girls with disabilities that you can see on this slide were created in consultation with women and girls with disabilities and are found, as with all the concepts and discussion points we've raised here today, in changing the landscape. So running through the list here, we can see these are to centre the input of women and girls with disabilities. This means to properly understand and address violence against women and girls with disabilities by creating safe, accessible opportunities for women and girls with disabilities to share their lived experience and be recognised for their expertise. Ensure autonomy, community ownership and control. Ensuring that efforts to prevent violence are relevant and meaningful for girls and women with disabilities, creating programs to prevent violence and promote gender and disability equality with women and girls with disabilities rather than for them. using co-design, which involves authentic and genuine partnership and power sharing, placing the knowledge, expertise, and lived experiences of women and girls with disabilities at the heart of a project, empowering women and girls with disabilities to make informed project decisions, using a strengths-based approach to empower individuals and communities, or to use or build on their existing strengths, to build partnerships and opportunities for collaborations, to improve the efficacy of primary prevention initiatives through genuine collaboration between the disability, violence against women, and women's health sectors, relevant public bodies and individual activists and consultants, and recognize lived experience and expertise, to be respectful and authentic. So to build positive and equal working relationships with women and girls with disabilities and respect difference and human diversity, give credit and equitable remuneration to women and girls with disabilities who contribute their time and expertise, ensure the physical and emotional and cultural safety of women and girls with disabilities. So those implementing prevention work must be supported and trained to work in safe and trauma-informed ways, respond appropriately to disclosures of violence, and connect with women and girls with disabilities to appropriate services for psychological support, ensure accessibility and inclusion, ensure women and girls with disabilities can be involved in the design, development, and implementation of prevention work on an equal basis to people without disabilities. Prevention practitioners must ask people about their access requirements, commit to making all reasonable adjustments, and build into budgets sufficient time and long-term funding for access requirements. Ensure prevention work is informed by critical frameworks. So for our work to prevent violence against women and girls with disabilities to be effective, that is evidence-based, gender transformative, and grounded in human rights, it must be informed by the social model of disability and intersectional feminism. And lastly, we ask that we contribute to the evidence-based. So limited available evidence about what works and what does not work to prevent violence against women and girls with disabilities is a huge issue right now. So we must consider the opportunities to document and share the results of evaluations of prevention efforts to understand better what works and what doesn't work so well, so we can improve outcomes as an ongoing and collective effort. So I'm going to bring back our wonderful partner, Hayley Davis from Women's Health Loddon Mallee, to talk about how we change the landscape together and think about the work that we've done together with them in the past. So, Hayley, are you there?
Yes, hello, can you hear me?
Hello. So in 2020 or 2019, before I was around, Women's Health Loddon Mallee and WDV partnered as a part of the Women's Health Services Capacity Building Project. And I would love to hear more about your experience, Hayley, about how what you have done to change the landscape.
Sure, thanks, Lena. I'll try and be quick because I'm mindful we're nearly at our break time. So we use the auditing tools that Women with Disabilities Victoria created, and our approach was a whole of organisation involvement, where our CEO, business and finance managers, health promotion staff, our women's health nurse, everybody was sort of involved, and that was really valuable because it sparked ideas for improvement across the board in different areas of our practice, rather than having a small group of staff trying to drive that change. And we developed a accessibility plan through that process with 4 main goals: that our services are accessible to all women, that our staff have what they need to work with us safely and comfortably, to make sure all staff are aware of disability and accessibility considerations and experiences, and commitment that procurements meet accessibility standards. And I've got a bit of an example of how our practice has changed, in that we now kind of have an unwavering commitment to upholding the principles of preventing violence against women with disabilities. And we're in a continual learning and improvement process with that. But we had some renovations done to our building, and our internal ramp needed replacing, and the usual building standards were going to create a space that wasn't inclusive and sort of had a separate entry point. And it took 2 years of insisting that we needed it to be done differently to maintain an equitable space for all, and also some educating and advocating along the way. So we found a builder who would work with us to meet the building standards and create a space also that where everyone felt equally valued. And we're also, adopting more inclusive practices in planning and delivering events. So in the past, we wouldn't have had Auslan interpreters or had any consistent mechanism for people registering to let us know if they had any accessibility requirements.
Can you tell me a little bit more about your process behind making these changes? So does this only occur for disability inclusive or disability specific events, or does this happen across the board?
No, our aim is that it just becomes embedded in our everyday processes. So for the past 2 years, we've been holding online events, and we're only just entering back into the realm of face-to-face. So it was really important for us to become, to improve our online accessibility, as well as our physical spaces for events and training. And so we immediately made the change to Humanitics from Eventbrite, because we learned that that was a better platform in terms of accessibility. And we're just aiming to make sure everyone feels able to register and participate, where accessibility is always a consideration and not just a bit of an afterthought. And as I said, we're always learning and refining this process. And another example is we recently had a learning experience where we made some, I guess, slightly ableist assumptions about participant needs based on the type of disability the cohort had, and hadn't considered the diversity of experiences of disability within the group. So it's prompted us to review our communication before events to fully understand all participant needs with workshop delivery and planning. So we just have a culture to constantly reflect on how we could be doing things better, and also checking in on each other as a method of collective care, and recognising that people's situations can change over time. So even as a staff, we can't make assumptions about each other's needs as well.
I love that transparency, Hayley. Could you tell us quickly some of the examples of activities you have undertaken with local partners from the Loddon Mallee region to change the landscape?
Sure. We've connected with the Bendigo Deaf Hub and delivered a workshop around breast health, and there's some screening sessions planned in partnership with Breastfeeding Victoria for Bendigo Deaf Hub members as well. And you'll see on the slide there, during that first session, the participants let us know that they felt really seen and included by the sign that was located at the place where that training occurred. So there's sort of plans to co-design a similar sign for our sexual and reproductive health clinic, Well Women's Clinic here. Anyway, that's kind of like a watch this space. And when we were undergoing significant building renovations, we added, we reached out to some local experts to give us feedback on their experience engaging with, the external and internal spaces in our building. And I don't think we would have had the confidence to do that without having gone through the auditing and reflecting process with Women with Disabilities Victoria.
Beautiful. Is that about what we have time for?
Yeah, I think so. Yeah, and I'm happy to answer any questions if anyone listening would like to email me or Lena. And we might stop for our break that we promised. Sorry, we're a little bit late with that. And we will return at 10:35, just so that we have lots of time with Nicole. And so, yeah, go grab a cuppa, have a loo break, whatever you need, and we shall see you back here at 10:35. Thanks, Lena. We have reached 10:35, so I will welcome everyone back. And Nicole's arrived. Hooray! Welcome, Nicole. Thank you so much for joining us today. And I want to start by letting everyone know a little bit more about you. So Nicole Lee advocates for women and girls who have a disability who rely on family members or carers for support, and is a survivor of family violence. Among her many achievements, Nicole is a writer for Women's Agenda, a board member of Safe Steps Family Violence Response Centre, and was a member of Victoria's first Victim Survivors Advisory Council. Nicole has been instrumental in shaping the way Victoria responds and works to prevent family violence, and also beyond Victoria. She's heading to Sydney, I believe, soon. And she continues to provide vital advocacy work through a range of public forums, including speaking at events just like this. And we're really excited that you could be with us today. Welcome.
Yeah, thanks for having me here and inviting me to speak. It's pretty awesome. I mean, these resources are just, fantastic and long overdue. So it's really good to be able to be part of, sort of launching this or, and promoting it as well.
Great. So yeah, we are here to unpack what changing the landscape means. And so the four of us, myself and Lena and Helen, will have a bit of a chat about about what that means to you, and also perhaps take some questions in the chat as we go along. So if you think of a question for Nicole, please pop it in the chat, and Sarah will be sort of filtering through those, and we'll pull out some that are kind of being asked frequently, or try to get to them all. We'll just see how many we have. So please tell us what it means to put unconscious bias to the side in our practice and our everyday lives, and what respect and equality looks or feels like to you, Nicole.
Yeah. Okay. So what does it mean to put ableism or and put those biases to the side? And I'm studying social work at the moment as well. So one of the concepts that came up in my master's degree was the concept of stigmas and schemas, and how that relates to how we relate to people we work with women with disabilities and people with disabilities. And so I wanted to sort of touch on that, because it's really important for a lot of this framework, and when I say sort of leaving that bias at the door and putting that at the door when you're working with people, and why. So I found a really great quote around a schema in social science it's the mental structure that an individual uses to organise knowledge and guide cognitive processes and behaviour. So people use schemas to categorise everything they see every day. This is something that we all do automatically on a daily basis. Every time we come into a situation, a person, a scenario, we are constantly, as a survival mechanism as humans, part of our makeup is that we're judging that situation, we're assessing that situation. And so, all of this, the changing the landscape, putting that ableism to the side, putting those biases to the side, is knowing and recognising and acknowledging that every single one of us do this as an automatic reaction, and to be prepared to, when you're working with someone, sitting down with someone, but if they've got a carer in the room, being able to go, okay, now I'm judging this scenario and this is automatic and I cannot stop it, but I can put it to the side, and I'm not going to buy into those things that I'm automatically, coming up in my mind and that I'm thinking about. And it's being able to acknowledge that you're doing that as a person and being able to set it to the side. This is really important when you're working with women with disabilities, especially if there's a carer in the room. What that means is that you know, we start to question that halo effect which was talked about earlier in the presentation around, you know, the pedestal that we put carers on. Now, I know my partner was put on that pedestal as, you know, this hero carer that had taken on this disabled woman with children. You know, she was a single mum, you know, I was a single mum and a disabled woman, and what an amazing human he was, when actually he was really abusive. And as everybody knows, he was very abusive. He went to jail, but nobody could see past that halo effect. Nobody could see past what they were, you know, sort of seeing and judging on that, you know, first sort of, you know, basis when the two of us would come into a room together. Nobody would question why this man had to come into every single appointment with me, whether it was a pap smear, whether or not it was to see my gynecologist, because, you know, when I was, you know, about ready to have my youngest child, you know, all of those things. And that's what, you know, this framework tells us, is to set that to the side, assess the situation, you know, look at the moving parts for what they are, and start to really question some of those biases, some of that ableism that we've been sort of steeped in and marinating in for so long whenever we're working with someone, interacting with someone. And then we start to really shift that narrative, and we start to give power back to the individual. Now, you know, the other you know, part of all of this is you know, setting that bias to the side, questioning that ableism is, and I noticed this very recently. I have my youngest child has a disability, is neurodiverse and a trans woman, and she won't speak in appointments. She is very anxious and will not talk in appointments. But we went and we saw a doctor, and this doctor was fantastic in that whilst I might have been answering the questions, this doctor continued to aim all of the responses towards my child. Even though I was responding, the doctor made sure that the person that they were interacting with was actually the client, was actually the patient. And whilst she wasn't talking, she could see that that was happening, and she felt valued and she felt part of the conversation. She didn't feel like she was being talked about as much, and it made her more comfortable. So it's all of these little things, even if the person isn't communicating with you and somebody else is communicating for them, it's directing that attention at the woman with disability, at that person with the disability that is the, you know, the client that you're working with, you know, irrespective of a carer being in the room. That's not rude to the carers, I guess. For carers, maybe we need to start expecting that more, and carers do need to start expecting that more from services. But just, it's all of those little things. If we can just start to shift our thinking around this, you know, who has the power in the room? Who has the authority to speak in the room? Who is the one that we're actually meant to be directing a conversation to? And we start to slowly break down all of those lifetime of disempowering experiences that a lot of us have experienced over the course of our lifetime. So I know for myself, growing up, my mum would always speak for me. All the decisions were made without my consultation. I just went along and everything happened around me. And that created a scenario as an adult where I didn't think I had the right to speak up. But if we start to shift these things, we start to create scenarios where people feel that maybe they might be able to speak up, maybe they have a right to speak up. You know, it changes all of that breaking down of someone's confidence and starts to shift it into, you know, actually building people back up again, and why all those sorts of bits and pieces are really important.
Yeah, my mind is going crazy with things that I could pick up on and what you've said, but I feel like there's a theme of consent in there, in building consent, the understanding of a culture of consent right from childhood and through to the systems, you know, and the services, embedding that theme of consent through. Lena or Helen, do you have?
Yeah, and how empowering one another can be built through consensual language, and to just simply ask someone and give them the space to speak for themselves, or for, like, to really give someone space and to know and allow someone to be themselves, you know.
Yeah, it's incredibly empowering to feel like you're part of the conversation. And, you know, and a lot of the time we just haven't been part of the conversation at different points in time in our lives. And this, you know, changing the landscape is really speaking, for me, definitely speaking to that angle of feeling disempowered, you know, in so many scenarios. And it's just such small things that can make a huge difference for someone. And feeling valued as a person, valued as a consumer, you know, valued as a client, a patient. You know, once you start to feel like you've got some self-worth, you can start to feel like you deserve to speak up for yourself as well. And those small little things that, you know, along the way, every time you do it, every time you implant those things, you know, we take them on board, and that slowly shifts us into feeling more empowered as individuals. Now, I wasn't, you know, was nowhere near like this many years ago, like I am right now, but, you know, and that has taken time, and it has taken working with different workers who have, you know, shown me respect, taken their time, you know, and, you know, worked at my pace. And that's the other thing around, you know, putting that bias and that ableism at the door, is also understanding that for some of us, it's going to take a little bit longer. We're going to need more time. You know, the amount of time that you might work with, say, a woman without a disability might be a hell of a lot less than what it would be with somebody with a disability. For some of us, we're going to need more hand-holding. We're going to need more time and patience as well. And all of those elements add up and create an environment where we feel safe and valued and respected.
Yeah, I was just thinking of something that our sexual and reproductive health, women's health nurse shared, in that she started to adapt appointments to longer appointments for people who might need to just even come in and start feeling comfortable in the environment, let alone have the procedure or have the consultation. And then they'll come back a second time for the consultation, and once they're oriented to the space. And so being flexible to change systems, you know, usual processes, so that everyone's included and gets the care that they require.
Yeah,
absolutely. Great. Helen, would you like to?
Yeah, Nicole, it's Helen. You've talked a little bit already about changing the landscape and how important it is for you that it's been released. Just building on that and thinking about prevention, what do you think is needed in our communities so that women with disabilities can be better supported and violence can be prevented? What do we actually need to practically do in communities?
Better rates of inclusion. I mean, which is, we like, I think we're getting there with inclusion, but if you look at within governments, I don't see any, you know, women with physical disabilities. There might be women with, you know, invisible disabilities working within Parliament, within government, within, you know, all of those higher up structures. They may be there, but we're not aware of it. And if they are, they're obviously not comfortable in disclosing that they've got a disability. You know, I think for me, just seeing us represented more broadly across, you know, different areas of society, and not just in those traditional, you know, female-orientated roles as well. You know, it's in the decision-making positions, in hospitals, in, you know, even within the police force. I mean, all of those, you know, key critical places where, especially around violence prevention. So, you know, sorry, I've just lost my train of thought there. But, you know, if we had, you know, women with disabilities represented within the police force, how much easier would that be to make a statement to another disabled woman as a disabled woman and a victim? You know, all of those things, you know, that would be brilliant. And I think we're starting to see that shift, but it's just really not fast enough for my liking. I'm impatient. That's me. Yeah.
Yes, it also means that women with disabilities can take on more of the role of setting the policies and you know, deciding how decisions will be made for the lives of women with disabilities and women without as well.
Yeah, I'd like to see us in the driving seat in far more reaching places. Like I worked in DPC briefly for a little while, but you know, more women with disabilities working within DPC, not just DPC coming to Women with Disabilities Victoria and asking for us to consult, actually employing us as policy officers, as senior bureaucrats, where we're making those key critical, you know, decisions on a daily basis. Sorry, just getting comfortable. You know, those things are vital, because you know, that's where, you know, the policy is conceptualized and developed, and then you know, grows from there. And if we're not there in those key, you know, initial stages, then you know, we're already behind the 8 ball. You know, and yeah, they're the things that I'd love to see, you know, changing, you know, much quicker than what we actually are seeing right now.
Thanks, Nicole. Lena or Hayley, are there any questions that you have, or any coming through in the chat?
Do you have any questions in the chat, Sarah?
I haven't got any questions at the moment.
Okay.
Yeah, just a reminder to everyone, feel free to pop some in.
So Angela says she completely agrees. I'm impatient too. Yeah. Yeah, please do just pop anything that comes to mind in the chat, and we'll pass it on to Nicole. And so, Lena, would you like to ask?
Sure, absolutely. So what I'd really love to know, Nicole, is what do you think something from Changing the Landscape, the resource that organisations and those who have joined us today can adopt from today or tomorrow even?
Well, yeah, I guess all the things that I've just spoken about before is around sort of really questioning and changing that internal dialogue that we all have, and starting to, I guess, push back on some of those, you know, schemas and things that we might have, and some of those biases that we might have. You know, I found a really, really beautiful quote. You know, writing an essay, and you know, from Gardner. So according to Gardner, critical reflection is not about judgment or criticism. Rather, it is about seeing the influence of the social context and creating a space for practitioners to be vulnerable and reflective about their work practices. So what that means is, you know, in your supervision is don't be afraid to, you know, to be vulnerable in those reflective moments, and to really, you know, pull apart some of the things that you might think or feel, or some of the concerns that you might have had when working with someone, or even some of the thoughts and, you know, some of those automatic things that were coming up in your mind, you know, based on that face value with someone, is, you know, to be vulnerable in that, you know, in that reflective time, in those moments, to really sort of pull apart, unpack, you know, why that's bringing that up for you, and what you can do as a practitioner to see things differently, address that, question, you know, what's going on for yourself, and why those things are coming up, and I guess sort of trying to put strategies in place on how to see things differently, and how to sit with it a bit better, or be more comfortable sitting with it, because some of this stuff is really uncomfortable. Like, you know, if you're working with someone and your automatic, you know, reactions are negative towards somebody, you know, that does make you uncomfortable. And I guess it's a matter of acknowledging that without judgment on yourself as a person, and just, you know, having that resource there in the back of your pocket, ready to go whenever you need, sort of touching base with it here and there to really, you know, sort of take it on board, you know, internalize as much of it as you can, and just keep referring back to it, just like any other piece of literature, any other tool, or, you know, that you've got at your disposal. Yeah, I hope that answered that.
Fantastic. I think we do have a question in the chat now.
Yeah, there's just been one come through from Tony. It says, what are the priority actions for services to build their understanding and capacity to be inclusive and provide services that are inclusive? How do we build knowledge in organisations around this?
Sessions like today, you know, attending sessions like today, hosting your own internal sessions with your staff after sessions like today. So having, say, maybe half a day with your staff where you go over all of the resources, read through it, discuss it, question it, you know, work out how that fits within your organisational context, and you know, and make an afternoon of it maybe, and do that in your individual teams or do it as a big group, and really work out how does this fit with your organisation and how can it, you know, strengthen the work that you're already doing, and yeah, make an afternoon of it and really just, you know, digest all of that resource. That would be my suggestion. Have you got anything, Helen?
I really like the suggestions that you've made, and I really like the concepts that you've addressed. That it's in each of us has the power to create some change as individuals in our organisations. You know, bringing people together and making it a collective change. I really like those concepts.
Eleanor Taylor here. I was thinking of the auditing tools. Women with Disabilities Victoria auditing tools. They're
use
available
those too. Yes.
on Women with Disabilities Victoria's website. I'm not sure whether Sarah or Kat can find that and pop the link in the chat. But they are just magnificent resources. There's current, I think they're being reviewed, but they're currently, correct me if I'm wrong, 16 booklets. And they each focus on a certain section. So if you were to say, because you can't sort of bite the whole burger at once, it's okay to take nibbles. And so, you know, if you want to say, okay, let's look at our communications, let's look at our website and just put an accessibility lens on that. There we are. Thanks, Kat. Okay. Oh, that's the Changing the Landscape resource, and here come the tools. Thanks, Lena. Beautiful. So yeah, the 16 booklets divide up sections like events and you know, strategic planning. I mean, I'll let you elaborate, Helen, but I think
you were doing such a great job, Haley.
Well, we used them, and it was fabulous.
Use them. That's right. But you're right, Haley. This is Helen speaking. The tools go through a range of different aspects of people work, informed by, you know, as it was then, changing the story. We're going to redevelop the tool to ensure it aligns with changing the landscape, but it also aligns with Victorian frameworks around free from violence, capability framework for prevention practitioners. So it covers things such as the way that organisations undertake and evaluate people work, the types of partnerships that an organisation might build with disability organisations and others, centralising the experiences and voices of women. We talk about strategies, budgeting, and then the audit covers areas that reflect current anti-discrimination in terms of disability. So things like access to premises, and not just the physical insides of places, buildings, but, you know, how do people get to the building, reach the building? What's the environment like at the entrance? Can people actually access the entrance to the building, let alone the interior? How do people navigate within the space? What happens if there's an evacuation or an emergency? What happens to people with disabilities? And as we spoke of before with Lena, events. How can events be inclusive? And we'll need to, the tool was developed in the olden days before COVID, but you know, obviously that's changed. So we'll need to add a lot more content around online event accessibility or hybrid accessibility. So it's always growing and developing, but it's also always available for you to use and learn from and give us feedback on as well.
I think some of the only things that I'd add in there with Helen to do as individuals, sorry, I'm having a bit of a interesting morning this morning, so I've yeah, please bear with me. You know, some of the things we can do as individuals within our own mind around questioning these things is around examining the way we think about disabled men versus disabled women. So if I bring up an example of what are the things we think of when we think of Dylan Alcott, and you know, and he's an amazing athlete. Yep, absolutely. But we think of him as being this inspiration, this hero. He's amazing. He's fantastic. But I don't know if, who in this room knows of, say, Sam Connor. And what are some of the things that people think of when they think of Sam Connor, or when they see her on the drum, and some of the, you know, quite negative and toxic abuse? So Dylan Alcott's a hero. An outspoken disabled woman is spoken of as being stubborn and fiercely independent. No, we're not fiercely independent. We're just independent. We're not stubborn. We're just women. But this is some of the language that comes in when you start thinking about and speaking about and positioning, you know, disabled women who are independent and outspoken, you know, versus disabled men. And you know, just I guess it's a matter of questioning that and being and recognizing that. And then pushing back on some of those public narratives when you see them, when you see disabled women being abused online for, you know, being outspoken, or, you know, talking on something like The Drum or Q&A, or, you know, any of those kind of shows. You know, it's pushing back on those things publicly as well for us. It's all part of this changing the landscape. You know, and that's where the changing the landscape, where that gender inequality and ableism collide, that make that difference. Now, you know, like I said, you know, fiercely independent versus a hero. You know, it's quite interesting, the narratives that come up, and people don't even realize they're doing it. But the changing the landscape gives us the I guess the framework to start questioning those things, the framework to you know, ask people to confront what do they mean by that. It gives us a framework in which we can start positioning these things and start shifting those narratives. You know, these are all things us as disabled, you know, as disabled women, we've known for a very long time. This is finally a set of principles and literature that speaks to what our experience has been like. It legitimizes, you know, though all of those experiences that we've all been through in our lives, and gives us, you know, tools and resources to point people to, or to use to help us push back on those narratives and start shifting those narratives, so we can create a better future for, you know, for our younger women and girls with disabilities who are coming up, you know, behind us as well. So, you know, that's what, you know, everybody wants to do in this life, is create a better world than what they came into, you know, and leave behind something better than what they had. And that's what this is for, you know, especially for me, and I'm sure it is for other people as well. That's really what this is. It's creating a better future for, you know, women and girls that, you know, that are still on their way, making their way into, you know, being teenagers and adulthood, creating a fairer, safer, and more respectful, you know, world for them to live in.
Fantastic. That's a perfect example of the crossover and intersection between, you know, gendered drivers of violence and ableist drivers, you know, those attitudes, that example you just gave. I just thought I'd read out a comment from Angela in the chat. She says, as staff members in our organisation, we all hold a specific lens, intersectional focus. It means that we can be intentional in learning and can be curious and ask questions and make reflections in staff meetings and planning sessions, etc. And I love that comment, Angela. We found that a number of our initial working group people are no longer with us, and we've got some new staff who weren't involved in the first auditing process. So we're creating, you know, ways that we can engage our current staff, and so we'll be giving a presentation in our next or a staff meeting coming up. Myself and another member who is part of the original process, and just to really onboard the current staff, and then we'll create a new working group so that we can, you know, sustain momentum and not just kind of go, oh, okay, that was nice and now that's finished, because it's such a, you know, ongoing process. So and then we will look at our accessibility plan and add things and kind of, you know, build on it and make sure that we're stretching that bit further, extending beyond the first actions that we took. Yeah, thanks for that comment, Angela.
Haley, it's Helen. I wonder if I could make a comment endorsing what you're saying.
Sure.
Because what I'm hearing is that there's a commitment to this process among the staff, which is fabulous, but also within the leadership of the organisation. And it sounds like there's a lot of support for the learning from the auditing process and the partnerships with WDV and local women with disabilities to continue. So there's time and space and resources allocated so that it becomes part of, you know, being at WHLM.
Yeah, absolutely. And it's that, as Angela said, making that space to be curious, ask questions and reflect. So yeah, just constantly reflecting on how that went and being safe to say, oh, we forgot this, or we had a really ableist approach to that, you know, oopsie, and kind of remedying it and working out where we kind of could improve. Yeah.
I might pipe in here and just reaffirm that change is good. And we want to change and progress and grow. And when you're doing that, you have to just don't be afraid to reflect and think, oh, there were things we didn't know before and that we now know now. And it's better that we share this knowledge with each other than think, oh, there was one worker that we don't have here that knew all this stuff. And so it's better that we share what we learn and think about, oh, what are the things that we're missing together so that we can progress forward as an organisation or as a sector or as a society or as a group of friends, or whoever you're working with, so that you can keep changing the landscape. And if you're changing the landscape, you're going to keep changing it, right? And change is good. Don't be afraid of it.
That's exactly right. Does anyone have any more questions? Keep them coming in the chat. Keep thinking. And I wanted to ask, as we've discussed before, Nicole, in our planning sessions, anyone can become reliant on systems, and in the realm of disability, you can, you know, you can acquire a disability later in life and sort of experience those systems. So thinking collectively, what needs to happen for organisations and services to sort of approach policies and I guess programs in that mindset, that in that universal design kind of mindset, I suppose.
Oh, that's a really big one. Again, all the things that have been discussed, it's oh boy, hang on, give me a sec to.
Yeah, sorry, that was a big one.
Sorry, I'm not my sharpest this morning. I'm really sorry about that.
No,
today.
I'll give you a moment. What about Lena or Helen? Do you have any comments on that? Or even people in the chat, would you like to respond to that question?
I guess, like, my understanding of that question was about how can organisations or services become more equitable and inclusive across the board, knowing that anyone can become reliant on disability support systems. And so what do they need to consider with that knowledge?
Yeah, I guess it's like taking on a perspective that there isn't a separateness to people with disabilities. Like, actually, the systems and structures that we create need to, I mean, it's stating the obvious in a way, but need to be accessible to everyone and work for everyone.
Yeah, it's a big motivating factor to have women and non-binary people with disabilities included in your organisations, in your planning and processes, not just for your activities that are disability specific, but through all your activities and policies, so that you are understanding of all parts of their lives, and so that for this question that you have about the reliance, that the idea that anybody can become reliant on disability support, more people have an understanding of what that means in every part of life. And also so we can advocate for better support systems.
This
Thanks,
is
Lynn.
Helen. I just got a thought. I was trying to think where I saw this quote, and I can't remember, but maybe someone cleverer than me today will know that someone I read recently said that disability is the only minority group that anybody can enter in life at any time, and there's no predicting when that will be. When we think about disability, we think about it as the other, that it won't happen to us. But the reality of it is that it will probably happen to all of us. And some of us, a friend of mine says, some of us come in from the ground floor and others of us enter at different levels of life. And as we age, disability is likely to be a more common experience. So bringing that realisation in to our thinking about disability, I think, can be vastly helpful, because it then isn't the other, it's us.
You know, it's everyone. You know, it's potentially yourself, it's potentially your children, your parents, your partner, your friends, everyone. It becomes part of your reality once you start thinking about it that way. And the other thing is, the resources captures the why disabled people are vulnerable, why disabled women are vulnerable, and then gives us the tools and resources to then start shifting that vulnerability. You know, that vulnerability doesn't have to be that way, and this is this is the, you know, the beautiful thing around, you know, these resources is that, you know, we can change this vulnerability, we can shift this vulnerability, we can put the power and autonomy back in individuals' hands, and you know, like Helen said, anyone at any point in time in their life has the ability to become part of this community, whether it's from birth, whether it's, you know, through an injury, or even through aging, the natural aging process. You know, we all have the ability to end up in this, you know, position where there's systems and structures around us that have enabled this sense, well, have enabled this scenario of vulnerability, which is not of our making. And how do we go about changing that? Or how do we go about advocating for people as they're coming into the disability community and realizing that this is their reality, this is now their world? How do we advocate for them until such time where they have the strength and they have the confidence to advocate for themselves? Because it doesn't come automatically. It's quite a big thing to have to come into and start realizing that you do have to speak up for yourself and how to do that, and that doesn't come naturally. And some situations don't feel safe to advocate for yourself, and sometimes we need external players advocating for us, because sometimes scenarios aren't safe for us to speak up for ourselves. They're not exactly the most safe environments for us to be outspoken and be forthright, and that's where we need all of those external things and resources like this that help, shift that vulnerability away from us and onto the system, which is the thing that needs changing. Like, our lives don't need changing, but the systems that create that vulnerability are the things that need changing. Yeah, I hope that sort of answered a bit more and led on from Helen nicely there.
Yeah, thanks, Nicole. Sure did.
I think that links back to the beginning of the resource when we talked about why everyone can take part in primary prevention, even when an activity or event or that they are undertaking it in their role at work or in play, they might not conceptualize it as a primary prevention activity. It's what we do upstream to prevent violence against women and girls with disabilities will support the systems in place when it could happen or when it is happening. And that's what we're talking about, and why this resource about changing the landscape is so integral and really important.
Yeah, and then violence becomes highly preventable versus for some of us, for a long time it's felt like it's just been an inevitable thing that was bound to happen, whereas it is entirely preventable with the right resources and the right attitudes and language and supports around us, and that's how we need to start thinking about it. Absolutely moving forward this is preventable. It is 100% preventable, and it should no longer be an expected, and it should be, the exception, not the rule, if that makes sense. Yeah.
Perfect sense. We have another question I've just noticed come up from Katja. Thanks, Katja. Changing the language from people with disability to people of different abilities, does that dismiss the position and needs of people with disabilities, or can this be a way forward to change the picture from the other to all of us? That's a great question.
You go either way with that one. I know there's a lot of people. I personally am very, very comfortable with the language of disability, and I see there absolutely nothing wrong or shying away from using the language of disability. This shifting of language, with disability, ability, that's a very, very personal question. And I certainly can't answer for anybody else with a disability on how the language they want to use. For myself personally, I like disability, but I certainly wouldn't have any problems with another disabled person saying that they wanted to use, changing it to, people of, what would you say again? Or is it people with of abilities? Different abilities, that's completely up to them. If that's how they want to identify, then that's entirely up to them. But I personally really like the language of disabled woman and that identity, versus, first language as well. It's not something to be ashamed of. It should be something that should be embraced, and we need to shift what we think of what automatic thoughts come up when we hear the word disability versus ability, and to not be afraid and to not shy away from that word. But like I said, if other people want to use, different abilities, then that's entirely up to them too.
Yeah. Fantastic. Okay.
I think there were just 2 comments above that last question as well from Joe and Lee.
Okay, great. Would you like to read those ones out, Kat?
Sure. So Joe says, I think it moves consideration of the needs of people with disability from a charity caring for a group to a universal approach. And Lee said, I'm a firm believer in equality and that we all have a disability of some type. It's the type of support that we need. It's the type of support that we need.
Thanks, Joe and Lee. Any responses to those, Nicole or Helen or Lena?
This is Helen. I might make a quick response to affirm Nicole's comment about people with disabilities needing to decide and be supported to use whatever language we would like to use in referring to ourselves. I personally am also comfortable very much so with the language of disability and disabled woman with disability. Probably a bit of a word of caution, and in saying this, I'm recognising that the ideas are coming from you know, a reflective place, but just some caution around historically we've tried in different ways to minimise disability, and we need to be careful that whatever language people use about us, as distinct from what we choose ourselves, doesn't minimise the experience of disability. So if someone without disability talks about us as being differently abled, or everyone has disabilities, that could be a positive comment, accepting all people as they are, but it could also be that the experience, some of us are good at maths and some of us aren't. That's not a disability. And it's not the same as the structural barriers, norms, institutions that we spoke of earlier. It's a bit like saying, you know, there's no race because some of us have got brown hair and blue eyes and, you know, our complexions are a little bit different. It sort of takes away the acknowledgement of the discrimination and marginalisation that certain groups experience from society. So just something to think about there.
Thanks, Helen.
Yeah, and disability pride is something that comes with time and practice. It's not something that's come automatically to myself. It's abuse that I've experienced based on being a disabled woman has been, hard to sit with and come to terms with over many years. But that pride is growing, and I'm certainly not ashamed of the word disability, and I'm certainly not ashamed of being a disabled woman, but that has taken a long time. And as I said, I really don't begrudge anybody who's still, who hasn't found that pride yet, who, as the words of Stella Young, it takes practice to be proud, and she's right, absolutely right. And it does take practice to be proud, and some of us need a bit more practice than others, and supporting people in the language they want to use is really key and critical around people sort of identifying and finding that pride within their disability as well. You can't rush somebody into it.
This is brilliant comments, and thanks for responding, Helen. I was pulled up the other day for, I heard someone similarly explaining that term, everybody's a bit on the spectrum, for people who have autism. If you have trouble, I don't know, maintaining eye contact, but other than that, you're fine. You're not a bit on the spectrum. It's not the same. So yeah, that really resonated with me, and I'm sure others in the group. We've had some people have to leave us and say that they really found the session great. So I think we will offer Helen and Helena just an opportunity to talk about some training modules that you have available. And also Rosie from Women with Disabilities Victoria has reminded me to say that our third Care Conversation event will be during September, Women's Health Week, and it will be Women with Disabilities Victoria. It will be a training session run by Women with Disabilities Victoria, and largely aimed at health and community service organisations, which sort of encompasses local government too. So, and please, everyone is welcome, and it will of course be relevant along the way. And so yeah, that will be on the 8th of September, but we'll be sending out information about that in the weeks before. And yeah, take it away, Helen and Lena, about your training modules that are available.
Excuse me, this is Helen. Just alerting people to the fact that WDV's Gender and Disability Workforce Development Team often holds training sessions. We call them calendar training. And the best way to monitor when they are on is to check our website and social media, because we promote them quite strongly. As Hayley said, thank you, Hayley. We have training coming up on the 8th of September during Women's Health Week. We're going to hold a session talking about access to health and inclusion of women with disabilities in health provision. And I guess that works, so giving women a place, women with disabilities, autonomy in accessing health provision, health services. So we look forward to seeing you again at that training. We have some other resources on our website, our videos, our fact sheets that are there. We have some new resources coming, which we will launch around access to health. So look out for those very soon. We've just produced a podcast around the experiences of women with disabilities in the context of COVID-19 and our influence and decision-making in the policy space in that. So it's going to be on podcast platforms in a matter of days, I think. So look out for that, and it'll be on our website as well.
That's very exciting.
So lots of resources. And if you have any ideas for resources or you'd like to engage with us, speak to us, you're more than welcome to email the organisation.
Thanks, Helen. So we were like the first public announcement, maybe, is that?
Yeah, just about. Yeah.
Can we claim that?
It's not quite there, but it will be around soon.
Great.
I'd love you to comment.
That's fantastic. I just wanted to take the time to thank Nicole thank you so much, Nicole, for your time today. It's been so generous, the stories you've told and the reflections that you've given everyone, and everybody's sort of saying in the chat how wonderful it's been. So yeah, thanks for your time. And I know you had a rough morning, but you know, yeah, you came and delivered. So beautiful, beautiful work. And thanks to Helen and Lena for creating this session with me.
Thank you for having us.
All, you know, the two organisations. It's been wonderful. And thanks to our Auslan interpreters, Rebecca and Esther. Brilliant. And thank you to the Women's Health Loddon Mallee staff who are kind of working away in the background there, supporting us today. I would really, really, really love you to give us some feedback, and Sarah will be sharing our SurveyMonkey in the chat and actually put a little slide so you can QR code with your phone. Okay. If you can do that now, thanks, Sarah. And yeah, if you have to run off to a meeting now or such, we will be emailing the code for the survey, so you can give us your thoughts later. Yeah, so take care, everybody. I hope you found the session useful, and yeah, please take the next couple of minutes to fill out this feedback form and let us know how you found the session, and have a great rest of the day. And